Hi, my name's Sara Randall and I'm an osteopath and a midwife. I also have a diploma in naturopathy and I've been working in this field for just over 10 years. The types of clients that I tend to see in practice are women that are generally pregnant or postnatal or bringing their newborn babies for treatment after perhaps a difficult birth. The types of clients that usually come to see me are ones that are pregnant or postnatal, and they're usually coming because they are interested in the fact that I've trained both as an osteopath and a midwife. So being one of perhaps only two in the country makes me stand out a little bit in the crowd. I qualified just over 10 years ago as a midwife, and then shortly after decided to train as an osteopath because I felt that women weren't being able to access necessarily through the NHS problems that they were experiencing, whether it be pelvic pain or back pain or rib pain that they were experiencing. So bringing in two professions together meant having that specialist skill so that women felt that they were able to access and enjoy their pregnancy rather than suffering through pain. It is true to say that some pregnancies do present with some discomfort for a lot of women. Your body's going through a massive changing element, so postural changes, hormonal changes, weight changes, all of this is going to have an effect on how your body functions. And so having the knowledge behind that development of not only the normal musculoskeletal system, but what's happening in pregnancy and knowing what will happen through your labour and the postnatal period, I think helps me equip you with a better treatment plan. Having had a baby myself last year, I got to see what it was like working on the other side of the fence, and I think that's helped me provide you with more realistic advice and understanding really what it is like to be pregnant and to have a new baby. I've also worked quite hard to set up 6 clinics within London and Hertfordshire. I direct the mother and baby side of these clinics, and we're known as Perfect Balance Clinic. We work with a team of osteopaths, physiotherapists, podiatrists, rehabilitation experts, so we're bringing in lots of knowledge to help women present with their problem but also to recover quickly and gain control in actually what they're experiencing rather than lots of ongoing treatment that you may experience with NHS or other osteopathic practices. Types of complaints that you might come to see me with are pelvic pain, symphysis pubis dysfunction, otherwise known as SPD, rib pains, low back pains, shoulder pains, all of those discomforts that you may be experiencing in pregnancy or in the postnatal period. Knowing breastfeeding can, on a daily basis for long periods of time can cause changes in the way that your body's functioning, so muscle aches and neck pains are what I see a lot of. What I love most about the job that I do is working with such a variety of women in the community. Any type of lady will come and see me for a variety of different conditions, and it's always a challenge for me to try and get to know that person and try and fix them as quickly as I can. I think women are daunted by coming to see osteopaths, particularly because they think they're going to have heavy manipulation or it's going to be uncomfortable treatment, but actually the techniques that I use are quite comfortable, a variety that will suit your body so that you get the best out of the treatment. Techniques that I may use with you are soft tissue techniques, so like having a massage, some gentle manipulations, so working on the joints. I'm also trained in kinesiology taping, so we can use the sports tape that you may have seen in the Olympics, so that works very well with pregnant ladies. I'm also qualified in medical acupuncture, so that works well with muscles and working in conjunction with the osteopathy. So there's a whole variety of techniques that we use that help you on that road to recovery. I think the additional benefits of coming to see myself is the vast experience I've gained within the NHS and in private practice, specifically with women who have musculoskeletal pain in pregnancy and postnatally. So all of my clients tend to be women or babies, and I see a lot of babies immediately following birth because women choose to bring the baby because I have an understanding of actually the birth process. I've attended lots of normal vaginal deliveries, lots of natural home births, caesarean sections, so I've seen firsthand what actually goes on, and being able to apply those principles into a treatment, especially with a newborn baby, has allowed me to get the most out of a treatment plan and get your baby and you well as quickly as possible.